Welcome. Thank you for joining us for today's webinar, NIPS Explained, a fireside chat about prenatal genetic screening. I'm Katie Schubert. I'm president and CEO of the Society for Women's Health Research, which is the thought leader in promoting research on biological sex differences in disease and improving women's health through science, policy, and education. Non-invasive prenatal screening, or NIPS or NIPS, is a type of genetic screening that assesses if a pregnancy is at an increased risk for certain chromosomal abnormalities, such as Down syndrome or Edwards syndrome. Prenatal genetic screening is one of the many innovative tools in the maternal health toolbox that can help women make informed decisions about their reproductive health and pregnancy management. It also has the potential to improve maternal and fetal outcomes by allowing women the opportunity to prepare to care for children who may be born with a genetic disorder. SWHR's genetic screening program in non-invasive prenatal screening and expanded carrier screening were launched in 2021 to address both barriers to access and health disparities related to preconception and prenatal genetic screening for women. And so today we are pleased to have Mariana join us for today's fireside chat. Mariana is a certified genetic counselor and the Associate Director of Programs at Expecting Health. I'd like to thank the sponsor of today's event, Illumina, and note that SWHR maintains editorial control and independence over our program development, content, and work products. And as always, we will be live tweeting during our event, and we invite you to join us and use the hashtag SWHR Talks Genetic Screening on all social media platforms. And with that, at this time, I'd like to introduce SWHR's Chief Science Officer, Dr. Irene Aninye, who is moderating today's event.
Thank you, Katie, and welcome everyone. A complete set of DNA contains 23 pairs of chromosomes combined from your biological parents. Variations or changes that have occurred in male sperm and female egg cells can sometimes result in clinically significant chromosomal abnormalities, such as an extra chromosome or a missing portion of a chromosome. These changes can affect the fetus or the baby growing inside the womb during development or after birth. And depending on the type of change in the chromosome, they can significantly influence the baby's health and well-being. Screening for genetic disorders can be done using a number of different methods and varies depending on the type of disorder being screened. There are different pregnancy-related screenings that each offer unique insights. Carrier screening is used to determine the chance of one or both parents passing on certain inherited genetic conditions to a child. Ideally, this screening should be conducted before conception, but it can also be done during pregnancy. Non-invasive prenatal screening, as we mentioned, is NIPS, is used to assess the risk of chromosomal aneuploidy, which is an irregular number of chromosomes that are in the fetus. NIPS can be performed as early as 10 weeks into a pregnancy. And the newborn screening is a national public health program that assesses newborns for specific serious but treatable conditions. This screening is typically performed 1 to 2 days after birth. Through the natural fetal growth and development process during pregnancy, some of the tissue from a mother's placenta, which contains similar DNA to fetal DNA, degrades, releasing this DNA into the mother's bloodstream. That cell-free DNA can then be examined by taking a blood sample from the mother and screening it for certain chromosomal changes. NIPS can be conducted as early as 10 weeks into pregnancy and is considered non-invasive prenatal screening because it only requires a blood draw that poses minimal risk to the mother or baby. It can be ordered alongside routine prenatal laboratory tests, and screening results usually arrive within 1 to 2 weeks. It is important to understand that NIPS is a screening test, not a diagnostic test. NIPS only provides information about the risk of certain genetic conditions. The typical conditions screened are Down syndrome, Edwards syndrome, and Patau syndrome. Screening results should never be interpreted as a concrete determination of you or your baby's health. If elevated risk is indicated, confirmatory diagnostic testing, either during pregnancy or after delivery, is highly recommended. We have assembled a working group of researchers and healthcare providers with expertise in gynecologic health and midlife care, patients and patient advocates, and healthcare decision makers who are committed to improving health for maternal health in women through genetic screening. With the guidance of these maternal health clinicians, genetic counselors, and advocates and researchers, SWHR developed a suite of educational materials to increase awareness about genetic screening and provide essential information for understanding NIPS so that women may have informed conversations with their providers before undergoing prenatal genetic screening. Our NIPS resource guide for women in particular was created to provide easy to understand content about the basics of genetic screening, conditions screened by NIPS, and the key steps in this process, as well as conversation guides with your provider and/or genetic counselor. To complement this guide, we're hosting today's Fireside Chat with special guest, Mariana Rea from Expecting Health. Mariana, you can turn on your camera anytime you're ready. Mariana brings over 15 years of experience in clinical genetics, healthcare, laboratory, and biotechnology industries. As a genetic counselor, she has helped innovate and deliver new models of patient care through patient-centered education and telehealth services. Her bio isn't just words on a page, but she's someone that I've had the privilege of working with and watching her in action as she builds awareness in the genetic space and leads efforts in family advocacy and community education. Now, we do have some topics that we would like to cover today, but those of you who are tuned in live are invited to submit questions throughout the event. You can do that using the Q&A function at the bottom of your screen. We'll try to address as many questions as we can during this program, especially submissions that cover recurring themes or questions with broad applicability to our audience. Please note that our resources and conversation today are intended for educational purposes and are not intended or implied to serve as a substitute for medical or professional advice. SWHR does not make medical diagnosis or treatment recommendations, nor does it endorse or promote specific screening or diagnostic tests. We encourage all patients and consumers to confirm information and consult a professional healthcare provider to determine their individual needs. So let's chat. That's what we're here for. So Mariana, how about you start off by telling us a bit about what you do at Expecting Health and why NIPS and prenatal screening is so important in the women's health space?
Yeah, first and foremost, thank you so much for inviting me to be a part of this chat. I think work like this is so important because it really does just bring to the table the discussion, and that's the best place to start. So thank you for the opportunity. For those that may not be familiar, Expecting Health is actually a nonprofit organization that I've been a part of for almost 2 years now in the role of Associate Director of Programs. And really our vision and mission at Expecting Health is to bridge the gap between science and data with real life lived experiences. And what do I really mean by that? We all are familiar and work in complex healthcare systems, and they're hard to navigate and they're hard to understand regardless of what your role in that system might be. So our work at Expecting Health really centers on maternal and child health programs that really aim to improve that process for all that are involved. So we do a lot of work directly with families, but also with various different healthcare providers, advocacy organizations, policy and government officials, and a wide variety of different people that are involved in the systems of care that we work in. A little bit about my background, because I know you mentioned that as well. I've had a bit of a long and windy career, as I know many listening in might also appreciate or feel similar to. I started as a genetic counselor in a clinical pediatric practice. And so I worked in a large academic institution for a number of years in pediatrics, working with families that had children diagnosed with a number of the conditions that we'll talk about today, and Dr. Nini that you've already mentioned. And sort of through that work, I was able to then take on a role in an industry-based setting where I got to work for a laboratory, that developed and offered prenatal screening to families and to patients directly. And so I've kind of got to see a little bit of both of those sides of things. And then from there, I've actually also had the opportunity to work for genetic service organizations where we really focused and aimed on trying to increase access to genetic counseling and genetic services through telehealth. And know that all of that work and kind of those different perspectives is really what brought me to Expecting Health, which again, I have the privilege on a day-to-day basis to really think about how can we raise awareness for these important issues and information in healthcare, particularly in the prenatal space.
Thanks. So for those that are listening in, you see why we invited her to, to this fireside chat. being able to have those different perspectives. And so why, if we can kind of start, why is NIPS important to women's health?
Yeah, I mean, it's a huge informational tool. And I think, a great place to start is to keep in mind that I think patients and providers are starting from the same place. And that is thinking about the best outcomes or the best care for either themselves as a pregnant person or for their baby. And, we've seen over the years lots of different technologies and tools that are used to help answer that question. Is my baby healthy? Whatever that definition of healthy may be to an individual. And so I think NIPS in that context has also grown and evolved in what it can do over the last 10 plus years. And so it's just a really incredible tool that is available for patients to utilize to help them gain insight, gain information on the health of their baby in their pregnancy.
And so, you mentioned it just being a versatile tool. What else can it do? Can you name some of the things that we know that NIPS can do outside of just looking at, for example, those three trisomies, the Down syndrome and Edwards syndrome? I know that's the most popular, probably the most well-known for people in this space.
Yeah, definitely. I think that's important. I mean, the purpose of NIPS and the reason for it being designed was to be able to, in a non-invasive way, be able to identify changes in the number of chromosomes. And so we start with the more common places where that happens, like trisomy 13, trisomy 18, and Down syndrome, which you already mentioned. But there are other areas of the genome or of chromosomes that can have changes. And so one thing in particular that I think is very commonly raised when we're talking about NIPS is its ability to look at the sex chromosomes. And so I think a lot of people recognize NIPS or cell-free DNA testing as the gender test. And I think it's important to sort of embrace that topic because it's real and it is what families and what patients recognize. So it absolutely can tell you the gender of your baby, but that isn't necessarily the purpose of the test. And I think that's a big piece to recognize in this screening is that while it can tell you gender, the real purpose of looking at the sex chromosomes is to see if the balance or if the amount of the sex chromosomes are what is expected. So the test can certainly tell you if there is an extra or missing copy of an X chromosome or if there are abnormalities in what we expect to see with the sex chromosomes of a baby. In addition to that, there's also other changes in smaller pieces of chromosomes that we can refer to as microdeletions. And so there are some common microdeletions that we do have the ability to screen for through NIPS. And if a baby were to have or were to be identified as having an increased risk for one of those microdeletions or with any of the conditions that are screened for through NIPS, as you mentioned earlier, it's incredibly important to then follow up with diagnostic testing to confirm that diagnosis. I think there's also some really innovative, there's some innovative things I think as well when we think about NIPS and its capabilities. That technology itself, we're starting to move into a direction where we can look at even smaller changes at the level of the DNA and single genes. And there are some laboratories that are developing tests where we can start to identify even single gene disorders and even start to think about applying the same NIPS technology in women's health to identify cancers and other things even outside of kind of the traditional chromosome abnormality test.
Wow. And so NIPS has been around for about 10 years or so, right? Mm-hmm. And we just want to take a little poll and get those of you who are tuning in to participate. And so our first question that we want you to weigh in, what percentage of women in the US have NIPS performed annually? Just give you about 30 seconds to weigh in. Again, what percentage of pregnant women in the US have NIPS performed? Zero to 25%, 25 to 50%, 50 to 75%, and 75 to 100%. All right. Poll is closing. Thank you. And then these are the results. We had majority, the correct answer is 25 to 50%. And so we had about 57%, majority of the people that weighed in were correct. 25 to about 50% of women, pregnant people, have NIPS performed. Our next question, we just like to take a bit of an inventory of those who are on the call today. With those who are on the call, there is no correct or incorrect answer, but this, in your opinion, who should get NIPS performed during pregnancy? Nobody, all pregnant people, only high-risk pregnant people, I'm undecided, or I have no opinion. Again, this question, we'll have the poll open for about 20-30 seconds. Who should get NIPS performed during pregnancy? Nobody, all pregnant people, only high-risk pregnant people, I'm undecided, or I have no opinion. Couple more moments before the poll closes. All right. Let's see what these results in. Majority say all pregnant people. There's about 14% high risk and about 20% undecided. And then we have something, well, there's definitely unanimous that it should not be nobody. Well, there's some undecided and some I have no opinion. Thank you so much for participating. And so with that, it's quite interesting. If a quarter to half of women are getting tested, we did see a majority of individuals, at least on this call, that would like all women to be tested, or at least high risk. What are the thoughts in this space about, testing and the guidelines for that?
Yeah, well, I think, again, as you mentioned, it's been a decade that NIPS has been around. And so as with all screening technologies, they change over time and they evolve, hopefully, for the better. And I think that's true to NIPS as well. So in 2020, there was a recommendation put out by the American College of Obstetrics and Gynecology that at that point did indicate that all women should be offered the opportunity to have non-invasive prenatal screening. And that was a big shift in the way things were done, because prior to that time, it really was only recommended and offered for women who were high risk. So I think that was a big step, certainly in a forward direction to increase the amount of women that have access to this important test.
Yeah, I think that's really important. Even some of the work that, we've done in this space with our working groups, the conversation about, having the conversation being a very important factor in it. And then now walking through that informed consent in whether or not a woman chooses to do the screening or not do the screening, but really making sure that every woman is offered the opportunity. Let's see, we have a couple questions that are coming in, and actually, how about this? There are, as we know, there's a controversial chatter surrounding NIPS at times, right? As to the accuracy, and some people, there's conversation or about, the results of this, or false positives, false negatives. And can you talk a bit about why the screening results may not match what is actually the condition, a health condition of a baby? And, what is a screening? I know we talked about screening and diagnostic, but why would someone find out that it's not indicative of a genetic condition?
Yeah, I mean, I think that when you ask a question about controversy, I think it's important to define what makes it controversial. And I think we hear a lot of anecdotes, and they're very real, and they're very real to the people that have lived them, where they're offered and they elect to have an NIPS, and they have a positive result in that experience. But when they deliver their baby does not have the condition that they screened positive for. And this can be really a difficult experience and conversation for the family, but also for the healthcare providers that are involved. And so really understanding how this test works and is designed is an important piece to that. When we're talking about a screening test, I often think and have seen in our work that there are a lot of different definitions to parts of this screening test, and they are easily confused or easily interchanged, and people don't necessarily mean to do that. So we hear words like accuracy or sensitivity or specificity. And those are all really important to understand for NIPS. When we talk about the accuracy of the test, we're really talking about its ability to identify what we want it to identify. So in the case of NIPS, if we're looking to identify babies who may be at an increased risk for having Down syndrome, can this test do it? Yes or no? And for NIPS, the sensitivity or the accuracy of the test is quite high. You can have a screening test that has really high accuracy, but still can have false positives because there are other underlying factors that change over the course of a pregnancy, like gestational age, maternal age, and factors that are incorporated into the interpretation of the overall result. So when you get a result, the important piece of understanding that result is a term that we call positive predictive value, or really understanding, now that I have this result, how likely is it that that result really does mean that my baby has the condition that it's screened positive for? That can change based on how far along you are in the pregnancy, how old you might be at the time of pregnancy, and other factors that go into that interpretation or that positive predictive value.
If in being able to explain that and break it down, right, so that the patient comes in, and we talked about sex being a determiner, that something that the NIPS can show, but then also these genetic conditions. Is there what have you found in working with a lot of women throughout, your time as a genetic counselor at Expecting Health? What are their concerns that we might be able to kind of touch on, bring some, audience to, that they are expressing? What concerns do they have when they're considering whether or not to pursue NIPS?
Yeah, I mean, I think the first thing is, and again, starting from that same best intentions, and I think that's true for providers that are caring for pregnant persons, and I think it's true for the person themselves. Everybody wants the best outcome and the best health of their baby, and I think that's really kind of a good place to start. And oftentimes in my experience, and I've done this myself personally, we sort of carve out genetic screening, whether it's NIPS or other aspects of genetic screening you talked about, like carrier screening or even newborn screening at the time of delivery. We sort of separate that in our conversations with patients, that it's its own thing. And it really is. But I think really thinking about keeping it simple and embedding the conversation about screening in the overall conversation of pregnancy and maternal care is really what has been successful. So starting early, starting even before pregnancy, to really raise awareness about what it is and what it can do and why it's important for people planning a pregnancy to be thinking about this. I think simplifying is hard, but that has been successful. So really asking questions of the patients that you're working with and the families that you're working with, of what, do they understand what they might do with this information? Do they understand what the test can and can't tell you? And how can we bridge that gap for those two things?
And because it's a screening test, and so it only can talk about increased risk. If someone gets back some results that say there's an increased risk for trisomy 13 or 21, what is the process? Then what should I do if that comes back?
Yeah, I think that's it's a great question. And it's certainly different for every person that goes through that experience. I think what often happens in that case, and what we like to see happen in that case, is that that individual gets referred to a specialist, typically a genetic counselor, that can really help them understand what those results do mean. And as we've been talking about, knowing that it's a screening, that means that we're casting a wide net and we're identifying a group of individuals that will have a positive result, meaning there's a higher likelihood that their baby has this condition that they've screened positive for. It's not a definitive diagnosis. And so, as you mentioned at the beginning, it's super important and it's so critical for patients to understand that when you have a positive result, there are next steps that often mean a diagnostic testing procedure. And so going to somebody like a genetic counselor that can explain the different types of diagnostic testing that may be available, at what points in time in their pregnancy those test options might be available, and really walking through what those next steps look like is typically what happens when someone has a positive screen result.
And so, as you mentioned, they might be referred to a specialist or genetic counselor. how does someone connect with one?
Yeah.
And, where does that would you do it immediately, or is it recommended to do it once you get a positive result, or, after a further diagnostic test, or post pregnancy?
I mean, I think as quickly as you can get connected to a genetic counselor, that will certainly improve the experiences. But I think, again, the reality, and I know there are likely genetic counselors listening into this. I think the reality is that we're in a situation where there's not always a genetic counselor available to meet and counsel a patient. Certainly the laboratories that are offering NIPS NIPS have that availability. Most of them have the opportunity to speak to a genetic counselor. So I think one place to start is certainly to reach out to the laboratory that performed the testing to see if they have genetic counseling services that a patient can access. But in addition to that, maternal fetal medicine specialists, the OB that ordered can typically help refer to a genetic counselor. NSGC.org is a great resource that provides a listing of genetic counselors that are available by state or zip code that you can search for. And there's also been an increasing number of service companies that offer genetic counseling virtually. So that, again, we're sort of thinking about who may not have access to these services that we can bring this service to. So there's lots of families that live in really rural areas. We work very closely at Expecting Health with a number of really rural communities, and getting to a specialist, whether it's, a cardiologist or a genetic counselor, is really hard. They live 4 and 5 hours away. And so I think as a profession in genetic counseling and in medical genetics, there's been a big shift in trying to create service models that can be delivered virtually and really help raise that access or improve the access to those services.
I'm actually glad you mentioned that, because I was going to kind of follow on with that. I know some of the experience you have are these service models and telehealth programs. How has NIPS and genetic screening and genetic counseling changed during the pandemic? And kind of to follow up with that, what can we expect to see in the future? Will there be certain changes that are going to be sustained, or do you think we'll go back to what it was pre-pandemic as far as practice?
Yeah, I think that is a really, really interesting question. And I will speak to my personal experiences during that time, because I actually changed kind of right in the middle of COVID myself. So at the beginning of the pandemic, I worked directly for a company that, again, offered these services directly to patients. And that was already in place before the pandemic. So patients could schedule the entire experience of seeing a genetic counselor, being evaluated, receiving results, providing next steps is all done virtually and through a telehealth model. That was already in place prior to COVID starting. And so when COVID happened, we absolutely saw an increase in the number of patients that were reaching out for services through that model. I did transition in my roles mid-COVID and moved to Expecting Health at that time. And so, anecdotally, I think we're starting to see a bit of a dip back down, and particularly in pregnancy. And again, I know others listening in probably have even more experience than I do in this. Even during the pandemic, I think most providers were doing everything they could to continue to facilitate in-person visits for pregnant people. And so I think we'll continue to see, pregnancy and NIPS happen in a traditional sense in a clinic. However, I think that this access to pre-test and post-test counseling will increase with the use of these telehealth models. It already has, and I think we'll continue to see even more patients access genetic counseling services even before they have prenatal screening. And that helps them not have to go in for an extra visit, or they may not have to travel far to get to that service. So I'm hopeful that that is what we'll see in the future and continue to see.
And how much do genetic counselors engage the carrier screening process or newborn screening process?
Yeah, I think it varies. I think it really depends. I think there are some genetic counselors, and many will touch on all aspects of that early in the pregnancy. And so, You might go in for a first trimester visit, and if you're a patient that happens to be seeing a genetic counselor at that time, then that genetic counselor may explain or lay out that there are different types of screening and the points at which they may happen. There are a lot of patients, though, and a lot of families who aren't going in for a first trimester visit and who aren't being seen at that point in time. So when they learn about that information and who is sharing that information with them, absolutely, I think varies across the board. We do, again, kind of going back to what I had said earlier, I think we have an opportunity to, instead of thinking about genetic screening as these individual siloed screens at different points in time, really helping raise awareness for patients and families that there are lots of different screening options that are available. All of them are aiming to do the same thing. That's to identify what your risk might be to have a child with a particular condition. And then there's nuance into what each of them does and how it's done.
And so for someone who can't access a genetic counselor, either distance or is not aware or doesn't know, what would you recommend would be a next step or an alternative to kind of tide over? Maybe the appointment's going to take months or, a long time to get in. What recommendations or what resources would you recommend tying somebody to in that time frame?
Yeah, I mean, I think the work that we all did and that you all led to facilitate this guide is a perfect example. I think we need to continue having conversations where we're bringing together all people that are involved in a particular aspect of prenatal care, in this case, NIPS, and provide tools and resources that can be shared directly with families so that it doesn't have to come from one particular individual, that, we're raising awareness, we're all speaking the same language, and that those services and tools are easy to gain access to. So, I think education is certainly a step in the right direction, but it's not the only step. I would definitely encourage families and individuals who may not be able to reach out directly to a genetic counselor to first talk to their provider, because oftentimes providers or the institutions or systems that they're a part of can help do that. If that's not possible, the reality is we get a lot of our information online and we need to meet families where they are. And so let's make sure that if families are going online to get information, that we're putting information out there that is accurate, accessible, and helpful so that people have that information as they're thinking through these decisions.
Awesome. And so what is utilization, because we said 25 to 50% of women get NIPS performed. So we know not every woman is getting it, not every pregnant person is having NIPS done. Can you speak to some of them? We talked about some of the, barriers to access or information, but what about the utilization? Do you feel like there are any particular barriers that are important to highlight and address for different populations of women?
Well, first and foremost, again, I think we said this earlier, but NIPS is not a required test and not every patient is going to elect to have it. And that is okay. I think that is definitely part of, when we talk about recommendations that have been put out there by professional societies, the recommendation is to ensure that families are offered this test. And to be offered this test, it's to also understand what information you can gain from it and how you might use that information. So I think, thinking about how to have that conversation with a family, that is where that is what we need to be able to do.
And so for those who might have a challenge, I know one of the things with offering it, there can be bias introduced, there can be education, there can be the very, not knowing how to approach the conversation or understanding the cultural sensitivities. What advice would you give to a healthcare provider who is in that first trimester appointment visit with a pregnant person and being able to raise this conversation to make sure that everyone is being offered in a way that's received by them?
Yeah. We talk a lot about this at Expecting Health, and some of the work we do as we're developing different programs that are targeted for intended audiences of families. I think the first question we always ask ourselves, and I would challenge providers to do this too, is what assumptions are you already making? So before you even start to have a conversation with a particular individual or group of people, we all are making assumptions. I think that is the reality, but recognizing which ones we're making and why we're making them then helps us better prepare for, okay, is that an assumption I need to be making, or how do I need to shift my thinking? So I would definitely encourage, oftentimes I've heard myself, providers, when I was in clinical care, saying, well, I'm not going to talk to a patient about this particular NIPS because they can't afford to have the test, or because they may not, whatever, they may not, they're not, it's not going to change anything for them, was something we would often hear. And that is a big assumption that someone is making for someone else. So I think checking first, what assumptions are we making? And are those appropriate assumptions to be making? Probably not. And then in that case, really thinking about, okay, how do I open up the conversation? What questions can I start to ask to really understand, what does this individual really want to learn through these tests that we're offering, through these screens rather, that we're offering? The other thing I often, when I'm talking, with providers, and I'm putting myself in that bucket as well, is our words matter. Our words that we choose matter. And when we're thinking about having conversations about risk and what people might do, how that gets delivered is so critical and so important. So being sure that we're using words like screening. And I've heard it, and I've done it myself. We often say a screening test when we're talking about an NIPS. Well, is it a screening or is it a test? And does anybody really understand the difference? So I think being very intentional and knowing what words you want to use when you're having a conversation, the more you use those words, the more natural it becomes in the conversation. So I think, you guys have done a ton of work to really help provide education and training. Other groups have done a ton of work to try to provide education and training for OBs and for birthing providers. We work a lot with midwives. I think there's, a lot of opportunity beyond OBs to start to educate and sort of teach a common language that will help identify where there may be gaps culturally, regionally, and things like that. So really being intentional and thoughtful about what words we're using to describe and talk about this test, this screen in particular. I'm doing it myself.
And so even as we talk about the utilization and of course, matching the expectations of the families with the intent that the provider wants to use the NIPS for, what is the future of NIPS in your opinion? Have you come across anything or research that is talking about the potential to use a test to be more sensitive for other conditions or other applications for NIPS moving forward?
Yeah, I mean, I definitely touched on this earlier, and I certainly don't want to overspeak or pretend that I know the data off the top of my head, because I do not. But there is absolutely research being done, and both on the commercial side and research side to better, well, number one, to improve the current technology of NIPS for what it is able to screen for today. One example in particular that I can speak to, there are laboratories that are trying to improve the overall performance of the test by being able to test in patient populations that have otherwise been more challenging to test. And what I specifically mean by that is, in the case of individuals that have a high BMI, that can be a more challenging population or group to identify results in for NIPS testing. And there has been a lot of research and a lot of work done to try to improve the ability for NIPS to perform in the population of individuals who have a high BMI. And that's one very specific example. I think there are other examples where the technology and the application of NIPS is being explored. As I mentioned, I think the future of NIPS will definitely be able to identify single gene disorders. So rather than being larger pieces of a chromosome missing, at the smaller level of DNA, can you identify a single change in a gene that's on a chromosome. So, I definitely think that those are forward moving and it's not going away, it's around. So we have to embrace that and, really think about what are the tools and what are the discussions that need to be happening to continue to improve that process.
And so before we wrap up, I do have one last question for you. We get patients in general audiences, researchers, healthcare providers, industry policymakers that all tune into our events. What is one takeaway you would recommend for any particular group or all viewers to help them better support women as they navigate the prenatal genetic screening journey, whatever it may look like or be for each individual?
So that is such a hard question to answer. I
If
definitely,
you
I
could
know
die on one hill, which one would it be?
I know. No, something that really resonates with this work, but also the work that we do when we're working directly with families is meeting families where they are. And I don't just say that to be flippant or cliche, but really, like, if you hear nothing else today, hear this: when we're working with individual families or groups of people, we can't work with them well if we're not meeting them where they are. I think we try to fit, genetic screening into a visit in a clinic at a certain time. And for families that are hearing that information, we don't know, as genetic counselors or OBs or other providers, what happened 10 minutes before they walked in that door. What happened a week before they walked in that door? What happened a month before they walked in that door? And so I think it's finding that balance of recognizing that this is a sliver in a much bigger picture that we don't necessarily have visibility to. And if we can remember that and try to embrace that by asking questions, I could probably have a whole conversation about some of the disparities in our health systems that, as providers, we're really pushed to see a certain number of people in a certain amount of time and in a certain given day. And that takes away from this ability to build a trusting relationship with the person that you're seeing. Whether you're the patient seeing a provider or the provider seeing a patient, it's a relationship. And so if we're going to help people make these important decisions about the health and the care of their pregnancy, we can't do that if we're not building trust into that process. And so, I know that's a lot, and that's why I say, it's hard for me to put that into words, but I think if we could ask more, if the simple takeaway is ask more questions, you can ask more questions to the person that you're talking to, whether you're the patient, whether you're the provider. Try to start from that same starting point of, we all want what's best for you as a patient or for your baby, and go from there. I think that would definitely be my takeaway.
I love that. Actually, ask more questions, whether you're a patient or a provider, because you're either inquiring about them, about the procedure, about what's going on, but you're getting to know. That's building the trust by asking those questions and removing those assumptions. That's really, really good. Thank you, Mariana, so much for joining us today, for your time and your insight. We also thank Illumina for their support of this event and SWHR's non-invasive prenatal screening program. To help women navigate their prenatal journey, SWHR has developed a NIPS resource guide for women that covers more information about the genetic screening conversation we touched on today. We also have a clinician's guide to providing quality maternal health care. This genetic screening roadmap is a companion piece to the resource guide that provides an online hub and educational materials and resources to support clinical practice and discussion guidance for counseling patients. We also have on our website a poster that providers can hang up in their offices to help inform women about prenatal screening and maternal health care. Again, our resources and conversation today are intended for educational purposes and not intended or implied to serve as a substitute for medical or professional advice. SWHR does encourage all patients and consumers to consult a healthcare professional to determine any individual needs. And so we will send out an email with the recording of today's webinar to all registrants, as well as links to our resource guide and roadmap. So please be on the lookout for that. And to all our viewers, live and recorded, we invite you to connect with us on social media and visit our website, www.swhr.org, to register for future events, download additional women's health resources, and sign up for our newsletter. Let's continue this important conversation with hashtag SWHR Talks Genetic Screening. Thank you for joining us.